Good afternoon, dear students.
Good afternoon, sir.
Good afternoon, sir.
Okay, today we will discuss about vaccines. Already we have started yesterday vaccines. So today we will discuss vaccines of OPV, that is oral poliovirus vaccine, then DPT, diphtheria, pertussis, and tetanus toxoid, then finally pentavalent vaccine. So we will deal with these three vaccines today, right? Okay. So before going that, we will have a small pretest. Just we will check your knowledge. You can voluntarily unmute yourself and you can answer after 5 seconds after finishing the question. So starting with the first question. So at the primary health center level, vaccines are stored in mainly A, cold box, B, deep freezer, C, ice-line refrigerator, D, walk-in cold rooms.
Ice-line refrigerator.
Excellent. Any other?
Ice-line refrigerator, sir.
Yes, this might you might have seen during our RHTC postings when you visited the Rural Health Trialing Center in the Mangalam, right? So if you
Yes,
visit,
sir.
it might be easier question for you, right? Okay, we will see during the lecture and after that. Second question. So OPV bivalent vaccine contains which type of strains? A, P1, P2, B, P1, P3, C, P2, P3, D, P1, P2 and P3.
P1 and P3.
You can see our check from the internet, books, just you can tell the answer.
P1 and P3.
Okay, many are opting for P1 and P3, B option. Okay, we will see during the lecture. So question number 3. So adjuvant used in DPT vaccine is A, silica, B, magnesium, C, manganese, D, aluminum.
Aluminum.
Yes, some are opting for aluminum. Any other options you want to pick? And your active participation is very essential for running these online classes very effectively, right? This is, there will be no errors. You can learn through the errors. You can guess. Okay, so we'll move into the fourth question. So which of the following is not true about oral polio vaccine? A, induces both local and systemic immunity. B, maternal antibody is completely protective. C, live attenuated vaccine. D, it requires sub-zero temperature for long-term storage. Okay, again, you should eliminate the correct answer. Then you will be fixed with the which is not true, right? Okay, we'll move on to the next question. So pentavalent vaccine is A, 5-in-1 vaccine, B, DPT, Hep B, Hib, C, route is intramuscular, D, all of the above.
All of the above.
All of the above.
Excellent, great response. So most of the people are opting for all of the above. Okay. 112, please mute your mic. 112, roll 112, please mute your mic. Roll number 112. Okay, we'll move into the next question. Sixth one, administration of which vaccine can result in paralysis in children? A, measles vaccine, B, oral polio vaccine, C, DT vaccine, D, DPT vaccine.
DT vaccine, sir.
So some are opting for DT vaccine. Any other?
Polio vaccine.
Polio vaccine.
Okay, some are opting for polio vaccine. Okay, we'll move into the next question. 7. Open vial policy is not applicable to which of the following vaccine? A, OPV, B, pentavalent vaccine, C, measles vaccine, D, hepatitis B vaccine. This might be covered.
Measles.
Ma 112, who is 112 in our batch? Please answer the question. 112. You are not unmuting your muting your mic and disturbing the class. Roll number 112. Some of you can call her and please tell to mute her mic. 112, please. Okay, so this is an open vial policy. So some of the vaccines will come under this open vial and some of them will not come. So okay, we will see during the lecture. Okay, so identify this famous scientist: A, Jonas Salk, B, Albert Sabin, C, Maurice Hillman, D, Emil von Behring. You can guess.
Albert Sabin.
Okay, some voice we are hearing, that is Albert Sabin. He is okay. We will see who he is. Okay, ninth one. In one single visit, a 9-month unimmunized child can be given the following vaccination. That is never immunized. A, only BCG we should give to this never immunized child during the single visit at 9 months. B, BCG, DPT1 and OPV 1 dose we have to give. C, DPT1, OPV1, measles. D, BCG, DPT1, OPV1 and measles we have to give.
B, sir. BCG, DPT1, OPV1, measles.
Okay, so many voices you want to pick for D. Okay, we will see which vaccines you can give. We have to add one more thing to our lecture. Okay. So last question. So which of the following vial is not efficient for vaccination? A, B, C, D. So what you are seeing? Yes. Which is the vial not efficient for vaccination?
C.
B.
B.
You can pick multiple also in this question. Okay, many are opting for B. Okay, we will see what is this vaccine vial monitor. So how to read this vaccine vial monitor also we will see as an adjuvant to this all vaccines. Okay. So with this, we will start today's lecture with this specific learning objectives. So we will today discuss about OPV, DPT and pentavalent with these following subheadings. Again, the same you will be writing in your records, and whenever you got a question in your final exam also, again you can write these subheadings. So we'll discuss what is this type of vaccine, whether live or killed, then what is the doses required, what is the route of administration, what is the schedule of this vaccine, so which age group we have to give this vaccine, what are the different constituents of this vaccine, what are the different diluents, whether we use or not. Then what is vaccine vial monitor, what is open vial policy, do this vaccine comes under open vial policy or not. So what are the advantages of this vaccine, what are the different reactions or side effects, And finally, we'll discuss some contraindications for giving these vaccines, right? So we'll start with the OPV, oral polio vaccine. So also called oral or Sabine polio vaccine. So this oral polio vaccine was first described by Albert Sabin in 1957. So he is the man in the picture on the slide. So again, when he discovered it, it contains generally 3 types of viruses, live attenuated viruses. That is type 1, type 2, and type 3. So eventually, so type 2 was removed. At present, we are giving only type 1 and type 3. That is called bivalent OPV. So previously it is called trivalent OPV, small t OPV. Now we are giving bivalent OPV for this national immunization schedule. Okay. So just listen to the words of this Albert Sabin. So before that, so how this vaccine was started to the public? So how they have received it? Just go through this video, small beautiful video.
A medical genius, a hero. Those are just 2 of the compliments being paid to Dr. Albert Sabin, Polish-born New Yorker, came here to Cincinnati and Children's Hospital in 1939. Over 20 years as the hospital's virus and cancer research chief, he developed and tested an oral vaccine against one of the most frightening diseases ever. Polio crippled and then killed hundreds of thousands of victims. When Sabin came to Cincinnati, polio was crippling up to 30,000 American children a year. Dr. Helen Gluck was a UC medical student then. She remembers how frustrating it was just to walk through a polio ward without a cure or even a treatment.
You didn't know whether they were going to live, whether they were going to die, whether they were going to be paralyzed. And here you were, a doctor trying to help, and there was nothing to help them.
This is where Dr. Sabin worked to change all that in a 4th-floor lab at Children's Hospital. Here he cultured forms of the polio virus thousands of times, looking for some way to stop it. Search wasn't easy on him, or on his students, or his lab workers, like Paul Anderson.
Very demanding. Not everybody could work for him. I'll put it that way. I don't know how. But anyway, I stuck it out. I guess I could see a bit of pride too.
But all that grief and hard work paid off. What Sabin finally discovered in the 1950s was a weak strain of polio that would help the body's immune system identify and kill stronger polio strains.
Dr. Sabin's colleagues say that they'd often find him in a lab just like this one until 11, 12, 1 o'clock in the morning doing his very own research. But during the 40s, few of them ever thought that the work that he would do here would actually end up helping put Cincinnati on the international map of medical research.
I think it brought tremendous notoriety to Cincinnati. I think as far as the city is concerned, Albert Sabin was not a national figure. He was an international figure.
And we have a lot to thank him for. In 1960, many Cincinnati children were among the first ever to get his live polio virus vaccines in the form of sugar water or sugar cubes. They came during Sabin's Sunday vaccination drives. Back then, he explained why.
I've been asked to say a few words about the program of giving the live polio virus vaccine by now to all children in Cincinnati, including those who are reached the school. The purpose of doing it, actually, is to find out whether or not the reasons we have now for believing that poliomyelitis can finally be completely wiped out can actually be carried out under conditions of training we have before.
Okay, in the video you have listened the words of Dr. Albert Sabin, who has saved millions of children around the world. So the children are also very happy in taking this vaccine, as it is an oral vaccine, right? Simple oral vaccine, which contains the live attenuated polio virus, different type of strains, 1, 2, and 3, right? And you have seen some people who are then undergraduates during the start of vaccine. Okay. So we'll move into the, then trivalent OPV was switched to the bivalent OPV. In the first figure, just you can notice a big bubble, which is having both 3, 1, 2, and 3 strains. Then coming to the second picture. So in the April 2016, they have withdrawn the type 2 due to different reactions or side effects to minimize the effects and to improve the efficacy. Then they have given 1 and 3. This is called switch in oral polio vaccine, right? Then IPV is also having both the 3. Then both the combined OPV and IPV, injectable form and oral form. This is the best form of protection for the final stages in polio eradication, right? Okay, we'll go into the today's business. So this is what is this type of vaccine? This is a live attenuated vaccine. So we will give 2 drops. This thing you have to remember, 2 drops of vaccine, OPV, we will give to the child. So what is the route of administration? Again, drops we will give through the mouth, that is oral route. So coming to the schedule, so we will follow the national immunization schedule. OPV was included in the national immunization schedule. So again, so when we have to start this OPV? So we have to start immediately at birth, or if the child was not taken at birth. So again, we can give within the first 15 days. That is the maximum age we can give this OPV 0 dose. Then first dose of OPV, then we can give it 6 weeks, second dose at 10 weeks, third dose at 14 weeks. This is common. So along with this, other vaccines also we will give, like previously DPT, now it was changed to pentavalent, right? Okay, then again this OPV 1, 2, 3, they can give up to 5 years of age. That is a maximum. Then booster dose of OPV we will give at the age of 16 to 24. Again, maximum age is 5 years. We can give this OPV. So again, what are the different constituents? So at present we are giving 2, as we discussed in the previous slide, that is type 1 and type 3. So again, we are giving more than 3 lakh TCID50 of type 1 poliovirus, and again more than 3 lakh TCID50 of type 3 poliovirus. That is TCID is nothing but tissue culture infective dose. That is the maximum dose we have to give. It should be more than that. So previously we are giving more than 1 lakh tissue culture infected dose 50 of type 2. These both are 3 lakhs. This thing you have to remember, different constituents. Whether we are using diluent for this vaccine? No, we are not using diluent. We are using as it is, right? Then, so what is the mechanism of action? So this vaccine when given, it will induces both the local as well as systemic immunity in the children. So again, whether this vaccine comes under open vial policy? Yes. So what is open vial policy? You can unmute yourself and you can tell what is open vial policy. Very important question.
When one's vaccine is open, till how many days can it be stored, or whether it can be stored or not?
Very good, excellent. So again, open vial policy includes some vaccines. Again, under different terms and conditions, these vaccines can be used, open, use, and maintaining all the conditions, we can use up to 4 weeks or 28 days. And we will discuss briefly about this open vial policy at the end of the lecture, right? This vaccine comes under the open vial policy, OPV. And again, effectiveness is very highly effective, this vaccine when given. Then there are a lot of advantages for this vaccine. First one is easy to administer, as you saw in the previous video. Very easy to administer, and the children are also very enthusiastic to take this vaccine, right? So again, administered through orally. Again, you can induce both humoral immunity through antibodies and intestinal immunity in the local gut. And again, single dose, which can produce a substantial high immunity. Then this vaccine spreads immunity to others by excretion of virus. Then it will also be useful in controlling epidemics. And you know, this vaccine is relatively inexpensive when compared to the others. So these are the different advantages of this OPV. So we'll see what are different complications or reactions. Again, very rare reactions or complications we will find with this OPV, and rarely it can lead to the vaccine associated paralytic poliomyelitis. So VAPP. So this vaccine can cause paralysis. This thing you have to remember, right? Because we are giving a live vaccine, live attenuated vaccine. So it can cause paralytic poliomyelitis, vaccine associated paralytic poliomyelitis. So most commonly with the type 3 strain, then it may be a case of per 1 million vaccines given to the children, vaccinated children. Okay. Then what are the different contraindications for giving this vaccine? So again, common thing, that is immunocompromised individuals, that is like who are suffering with human immunodeficiency virus or malignancy, leukemia. So these are the different contraindications for this vaccination. Then how much temperature, where we have to store this vaccine? Again, this vaccine should be stored in the deep freezer. So at a temperature of sub-zero temperature, that is minus 20 degrees centigrade. This is the optimum temperature for maintaining this vaccine. Again, whether there is a vaccine vial monitor.
Purchase all relevant agencies of definitions, blah 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 blah. So after the introduction happens, you are going to be given time to entertain some.
Okay, so again, this vaccine vial will be having a VVM. So what is VVM?
Vaccine vial monitor.
Very good. That is vaccine vial monitor. So again, it is an dermochromic label which we can see on the vial. Again, there are different stages, mainly 4 stages according to WHO. We will see in the during the end of the lecture, right? VVM is also present on the most of all of the dermosensitive vaccines. Okay, so do you know any mass immunization programs against polio? Can you name some?
Pulse polio.
Very good, excellent. Pulse polio. Next, any other? Okay, so one more thing, it is called in the form of rainbow. What it is?
Indradhanush mission.
Yes, that is MI. Not Mission Impossible. It is Mission Indradhanush. That is, we will see a beautiful rainbow, right? All the 7 colors. Okay, so these are the 2 mass immunization programs against the polio. That is Mission Indradhanush, which we will give through all the children all over the India, starting with the small state, some states. Then it was given to all over the country. Then one more you said is pulse polio. This is a mass immunization program. So what is Mission Indradhanush? So which diseases it will cover? Very important question. Which diseases will be covered in Mission Indradhanush? You can name one by one.
Polio.
Very good. That what we are discussing is polio. Polio comes under this Mission Indradhanush. 1.
Tuberculosis.
Excellent. Tuberculosis. The other topic we are discussing after this vaccine, that disease also will be covered.
DPT vaccine.
What are the diseases?
Diphtheria,
pertussis, tetanus.
Tetanus. Then one more thing.
Haemophilus influenza.
Or hepatitis. Okay. So these are 7 different vaccines which will give to the Mission Indradhanush. Okay. So as you said, the same polio, pertussis, diphtheria, tetanus, tuberculosis, and we can also add measles and hepatitis B. Measles and hepatitis B. So right. So vaccination cover against the 7 diseases to more than 89 lakh children by 2020. This is the target taken by the government of India. Okay, pulse polio. So how many rounds of pulse polio will be there?
2
per year.
2 rounds.
Yes.
2.
Yes, good, very good. So previously, until 2018, there are 2 rounds of pulse polio. So we are at the stage of eradication, finished. So 2 stages, 2 rounds we are keeping, starting with the January 1st. Then after 4 weeks, again we are keeping the second. So now we are keeping the single, only 1 round since 2019, right? Only 1 Sunday we are doing. We generally do on the Sunday. So this is also Mission Indradhanush campaign. They are giving IEC materials to increase the awareness among the public. So this is pulse polio. So in the year 2020, they have given on the 19th January. So whenever there is a pulse polio, there is a mass huge campaign with all the banners sticked all over the municipal corporation limits and all over the India, wherever it is, right? So a lot of healthcare professionals will be working in delivering this vaccine. Again, we will give up to age of 5 years. So we will be giving 2 drops. Again, a lot of celebrities are also being used in this campaign for this pulse polio immunization. The most popular figure is Amitabh Bachchan. So throughout the world in all the local languages, right? So we'll see a small commercial given by the voice of the Amitabh Bachchan, which is widely popular to draw the people to bring their children less than 5 years of age to the pulse polio booths, right?
पालने में नन्हा जब सोता है तब हाथों को दर्द कहाँ होता है। जब दिखती है लाडली परी सी तो अपनी हालत का किसे होश होता है। अपना हर सपना भुला दिया ताकि उसका सपना हो सके पूरा। और पोलियो की खुराक पूरी नहीं हुई तो उनके लिए जो किया सब मत होगा। इसलिए हर हाल में पिलाइए पूरी खुराक, तब होगी पोलियो से सुरक्षा पूरी। जन्म से लेकर 5 साल तक 2 बूंद जिंदगी की, हर बच्चा हर बार।
अपने 5 साल तक के हर बच्चे को पोलियो की दवा अवश्य पिलाएं।
Yes, this is given by the NRHM. So this awareness video has attracted a lot of public, and it induces stimulates the brain of all the people, and they brought their children and immunized for the successful eradication of polio from our country. Okay, so we'll move into the next vaccine, that is DPT. So what is the type of this vaccine? So we have discussed live vaccine in the previous one. This is a killed vaccine. So again, this is a vaccine for diphtheria, pertussis, and tetanus disease. So how much dose you want to give? So that is 0.5 ml. So we want to give through which route? That is intramuscular. Through which side? That is anterolateral aspect of mid thigh. Generally, we will prefer left thigh, right? Anterolateral aspect of mid thigh. Then what is the different schedule? So previously we have given DPT 1, 2, 3. So it was merged to the pentavalent vaccine, right? So we will give the first dose with 6 weeks, 10 and 14 weeks, right? Along with the OPV. Then when we will give booster dose, there will be 2 booster doses, 1, 2. So first booster dose will give it 16 to 24 months, and the maximum age is 7 years. Then DPT booster 2 is 5 to 6 years. New age, maximum age we can give is 7 years, right? This is the schedule of DPT vaccine. So any adjuvants we are giving to this, adding to this vaccine? Yes. So that is aluminum. So aluminum phosphate or aluminum hydroxide, this is an adjuvant to the DPT vaccine. So what it will do? It will increase the immunogenicity of the vaccine, right? So what are the different constituents of this vaccine as like OPV? Again, it will be having diphtheria toxoid, tetanus toxoid, and killed organisms of Bacillus pertussis. And again, the adjuvant is aluminum phosphate will be there. And last one is thiomersal. Thiomersal will be there. It will be used as preservative for this vaccine. So what is the storage? So again, it will be stored as like all other vaccines. That is +2 to +8 degrees centigrade. So OPV is an exceptional, that is -20. So all remaining, most of the vaccines will be stored at +2 to +8. Again, this comes under T series vaccine, DPT. Tetanus is present, +2 to +8. And again, this should be never frozen. Don't keep in this deep freezer. So what is the efficacy? So again, against diphtheria, it will be almost 100%. Against tetanus also almost 100% protection. Pertussis or whooping cough, it is 75% protection. So what the reactions or side effects? So again, slight to moderate fever with mild pain you will experience after this injection. And rarely neurological complications will encounter like encephalitis, prolonged convulsions, or infantile spasms, or Ray's syndrome. This we can see as the reactions to DPT vaccine. So what are the contraindications when we should not give? So when the child is having convulsions or presence of progressive neurological disorder or hypersensitive in the previous given dose of DPT, or high temperature, that is fever, that is more than 104 degrees Fahrenheit, and when the child is on steroid therapy for different various medical causes, right? So we will move on to the next vaccine, that is pentavalent vaccine. So the name itself saying penta, 5. So what are the different 5 diseases it can prevent?
Diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza A.
Excellent, very good response. So again, 5 antigens against 5 diseases we will give, right? So this is a conjugate vaccine. 5 infections we can prevent, that is diphtheria, as you said, tetanus, pertussis, hepatitis B, and Haemophilus influenza B, that we can call it as HIB vaccine. So what is the dosage? Again the same as DPT, 0.5 ml. Again the same intramuscular, again the same anterolateral aspect of mid-thigh. Again, because it is a constituent of DPT is a constituent of pentavalent, right? The same you can write. So again, 3 doses we are giving in the pentavalent form: 6, 10, and 14. Maximum age is 1 year. So these are different states. 12 pentavalent introduction in the 8 states, which you are seeing in the green color: Karnataka, Tamil Nadu, Kerala, Gujarat, Jammu and Kashmir. Pentavalent vaccine again proposed in 2014, 12 states, including our Telugu states, Telangana and Andhra Pradesh. Then remaining states were started in the 2015. That is shown in the white color. Okay. So what are the different diluents? Do we use diluents? So as like oral polio, we do not use any diluents. So again, storage the same as DPT. Most of the vaccines we will store it +2 to +8 degrees centigrade in ice-lined refrigerators. So where we will found vaccines in a PHC, ice-lined refrigerator, that is ILR. And again, you can use conditioned ice packs to prevent freezing during the transportation. Again, open vial policy, this comes under open vial policy. So all the vaccines what we have discussed today, OPV, DPT, and pentavalent, comes under the open vial policy. So again, the advantage is you can reduce the number of pricks, right? DPT prick, hepatitis B prick, influenza B prick. So we can reduce the prick into 1, not the 3. So different adverse events after injections like redness, swelling, pain at the injection site. Generally, we see in the 25% individuals who are vaccinated. And different contraindications include persons with moderate or severe acute illness, right? And also, if there is a history of severe allergic reactions, these are also different contraindicated. This we will not give the pentavalent vaccine. Okay, this you might be seeing in a lot of medicine or any other, when you are starting giving injections. So how the needle position should be there. So our point is intramuscular. We are giving in the pentavalent or DPT. Again, it is at 90 degrees to the dermis or skin, right? So again, there are different positions of infants and children for vaccination, right? So we have to maintain the positions of these infants and children. So just go through this brief video. Just you can be noticing what are the different positions of these infants or children.
When vaccinating infants and children, it is important to keep the child still and make sure that both you and the caregiver are comfortable. Positioning the child correctly allows you to vaccinate efficiently. It also helps minimize unexpected motion and needle stick injuries. There are 5 recommended positions for vaccination. The choice of position will depend on the number of vaccines to be given, the age of the child, and the materials available. The first three are for infants, the fourth is for children aged 12 months or older, and the fifth is for adolescents and adults. Let us examine each position and the advantages and disadvantages of each one. In the cuddle position, the infant is lying sideways at a 45-degree angle on the caregiver's lap. The caregiver hugs the infant's shoulders and upper body close to her body. With her other arm, she holds the infant's legs. The advantages of the cuddle position are that the infant's arms and legs are securely held by the caregiver, and the infant is comforted by close contact. In addition, leg and arm injections are possible without changing positions. The disadvantages are that there could be a delay between injections if 2 intramuscular injections are given, since they would need to be delivered in different thighs, and it can be difficult to restrain an infant after switching sides. It is best to avoid this position if 2 intramuscular injections must be given. In the bed position, the infant lies on a flat surface with both legs bare. The caregiver stands on the side of the bed and holds the infant's arms. To give an injection, stand at the infant's feet. Make sure the infant's leg to receive the vaccine is slightly bent. Use one hand to gently cup the infant's knee. The advantages of this position are that the infant's arms are held securely by the caregiver and the infant is comforted by eye contact. Also, it is possible to give an injection in both legs without changing the infant's position. The disadvantage is that you will be responsible for restraining the infant's legs. The upright position is when the infant is sitting upright on the caregiver's lap, facing out. The caregiver rests the infant's back against her chest. She hugs the infant's upper body and arms with one arm and uses the other arm or her knees to hold the infant's legs. When you give the injection, stand at the level where it can be given at a 90-degree angle. One advantage of this position is that the infant's arms and legs are held securely by the caregiver. Another is that multiple injections are possible without changing positions. A disadvantage is that the caregiver is responsible for restraining the infant's legs, and the infant has no eye contact with the caregiver. For children older than 12 months, you can use the straddle position. In this position, the child sits upright on the caregiver's lap, facing her, with legs straddling her body. The caregiver hugs the child's upper body. The advantages of this position are that the child's arms are tucked securely under the caregiver's arms, the child is comforted by close contact, and multiple injections are possible without changing position. A disadvantage is that the child's thigh muscles may be tense, and unless the caregiver helps, you will be responsible for restraining the child's leg. For adolescents and adults, use the independent position. In this position, they can be vaccinated in the upper arm while sitting upright. The advantage is that you have good access to the deltoid. The disadvantage is that any restraint depends on you as the vaccinator. Regardless of which position you choose, remember to reassure the caregiver and child with a soft voice, explain the steps, and provide privacy. Now you know different positions for vaccinating infants and children.
Okay, we are thankful this Immunization Academy for giving this beautiful video. So now you have seen some different positions which you might be practicing when you are giving injections, right, to the child mainly. Okay, so this is we have discussed all these 3 vaccines. We'll go to the vaccine vial monitor and open vial policy. So what you are seeing, this is a vaccine vial monitor. This is thermochromic label, which it is like a sticker which will be sticked onto the vaccine vial. That is, we are seeing inner square and a outer circle, right? So again, according to WHO, there are different 4 stages. So 1, 2, 3, 4. So again, inner square is lighter than the outer circle. So again, in the second stage, a inner square is still lighter than the outer circle. Then the third stage, inner square is matching with the outer circle. Then the fourth one, inner square is darker than the outer circle. So we have to discard the first 2. We have to discard the 3 and 4. So we have to give the vaccine vial if it is in the stage 1 and stage 2. Stage 3, stage 4, discard. So again, it is in brief. Initial stage, again, it is a thermochromic, that is heat sensitive vial. So after some heat exposure, it will turning darken along with the on par with the outer circle. So discard the point in the stage 3 and this is called beyond discard point. So it is more darker than the outer circle. So these are the different stages, start point to the end point, right? So this is a demarcation in the middle. So this we can use and we can discard the last 3, right? So again, we have kept some different vials, 1, 2, 3, 4. So which vial we have to use for the children? Which vial you can use?
1, 2, 3, sir.
Very good, excellent. So we can use 1, 2, and 3, right? According to the stage given. So 4 we should not use. We have to, because it is crossed the discard point. So again, you can tell which vials we can use.
1 and 2. 1, 2.
Excellent. So 1, 2 we can use. 3, 4 we have to discard, right? Okay. So again, we will discuss something about open vial policy. So what is this? So it will allow reuse of partial use and multi-dose vials of applicable vaccines under universal immunization program. In subsequent sessions, it may be fixed or outreach up to 4 weeks maximum, that is 28 days, and subject to different conditions, meeting certain conditions, like it should be maintained at correct temperature, and you should write the time and date when it is started, right? And a lot of advantage there to reduce the vaccine wastage. So these are the different vaccines which comes under the open vial policy. So as we discussed, OPV, DPT, Pentavalent, all these 3 are present. Along with this, TT, hepatitis B, and IPV, inactivated polio vaccine. These are also present, and wastage permissible will be 10%. So again, you saw in the small picture, we are writing the date and also the time on the open vial policy, right? So which vaccines we will avoid? Which vaccines will not come under this open vial? That is BCG, Japanese encephalitis, and measles. So these are the 3. And along with this, we can also add rotavirus. These are also, we will not come under the open vial. So what they have to do? So again, after 4 hours of reconstitution with the diluent, or at the end of the session, again, we have given to all the children of that school or in your health facility. At the end of the session, you have to discard, or after 4 hours of reconstitution, whichever it is earlier, you should discard this vaccine, right? These 3 along with the rotavirus will not come under the open vial policy, right? Okay, so again, there is a small video how the new vaccines are developed, because now we are dealing with the pandemic COVID. So we will see a small video on how the different vaccines, how much time it will take generally. A lot of burning question for today's public or for tackling this pandemic, right? So a small animated video.
How do you create a vaccine to fight a new disease, and why does it take so long? Well, first, you have to identify the virus or bacterium that causes the disease. In some cases, the pathogen itself can then be weakened or deactivated and used to make a vaccine. But this isn't always possible. In these cases, the next step is to identify the pathogen's antigens, unique protein or glycoprotein markers, which can form the basis of a new vaccine. For some pathogens, these antigens always stay the same. Other pathogens, like the virus that causes flu, can change or mutate their antigens, and so these must be reanalyzed every year. Once you have identified the pathogen or antigens, you need to decide how you are going to use them to build a vaccine. This is called the vaccine platform. There are a lot of options here, like subunit vaccines that only use part of the pathogen. There are also newer or more experimental technologies, like viral vector or nucleic acid-based vaccines. But we'll get to these a bit later. You also need to decide how the vaccine will be administered, by injection into the skin or muscle, orally, like the polio vaccine, or through the nose, like some flu vaccines. Each of these options could affect the response the vaccine induces. For now, let's say you've decided on the platform and designed the vaccine. Next, it needs to be tested, first in cell cultures and then in animal models. This might include challenge studies, where animals that have been given the vaccine are deliberately exposed to the target disease to see if the vaccine protects them. Further down the line, and if the disease isn't too serious or effective treatments are available, humans might take part in challenge studies too. Once the vaccine candidate is proven safe in animals, you need to prove you can manufacture it to a high enough standard for people and at scale. This is called GMP certification. If the vaccine passes all of these stages, it's time to begin human trials. Normally, these come in 3 phases, and they all have to be passed. First, the vaccine is given to a small group of healthy people to test for adverse reactions. This is called the safety trial. Second, you give the vaccine to hundreds of people to work out what dose is needed to trigger a big enough immune response. Finally, you can trial the vaccine in thousands of people to see how effective it is. This step is often the slowest, and participants are sometimes recruited around the world. Researchers have to wait for participants to come into contact with the pathogen naturally. By tracking how many become infected, they can work out how effective the vaccine is at protecting the group. It can take decades to gather enough data to be sure. But if you do, the vaccine can finally be licensed. There are still problems to overcome, however. Mass producing a vaccine to a high standard can be a difficult job. And once you've cracked production, you still have to deliver the vaccine to where it's needed. And then there's phase 4 monitoring, keeping track of rare adverse reactions that the vaccine might cause, even though it's passed the previous trials. This trial process is very safe, but that comes at a cost. It is also very slow. In an emergency, there are ways to speed things up, like reducing the time spent waiting for paperwork to be completed, or running different trial phases at the same time. But steps are never missed out. By working more efficiently, a protective vaccine could be produced in as little as 12 to 18 months. And advances in biotechnology could speed up production pipelines as well. And there are more ways we could speed up production. Let's come back to some of those newer vaccine platforms. Nucleic acid vaccines don't use pathogens or antigens directly. Instead, they deliver the genetic templates for the antigens. These DNA or RNA templates can be delivered directly or in lipid nanoparticles that help them to enter cells and improve their stability after injection. These nanoscale fat droplets encapsulate the RNA or DNA, protecting it as it enters the body. Some lipid nanoparticles can also act as adjuvants, molecular triggers to kickstart the immune response. Once inside the body, these DNA or RNA templates instruct our cells to start making antigens which activate the immune response needed to build immunity. RNA and DNA are much easier and faster to produce in the lab than antigens are. They're also potentially safer than vaccines that contain whole pathogens. That means they could hopefully be used by people with weakened immune systems. But nucleic acid vaccines are still experimental. Another approach is called a viral vector. Viral vector vaccines work by inserting an incomplete segment of genetic material from a pathogen inside a harmless virus that doesn't cause disease. This then acts as a vehicle for the genetic material, delivering it to the right place in the body where it can be translated into proteins, triggering the immune system. The viral vector may even be self-replicating, increasing the amount of vaccine in the body. Viral vector vaccines are also quick to produce. Safe vectors have already been established, and it is relatively easy to insert different target genetic material into these established carriers. And as the genetic material inserted is incomplete, they can't replicate and cause disease, so they're also very safe. But there is only so much the process can be sped along. Effective vaccines can save millions of lives, but before they are used, they have to be proven to be safe and effective. In the future, researchers hope to develop vaccines against non-infectious diseases like cancers, based on chemical markers called tumor neoantigens. Vaccine technology is developing every day, and it has a bright future, albeit a slow and methodical one.
Yeah, thankful to the nature for giving this beautiful video. So how the different vaccines, newer vaccines, it will take some years to develop this vaccine, not it is a movement of months, right? Okay. So we have discussed the different vaccines. Yes?
Sir, after giving phase 1 vaccine, will they isolate the people or they will allow them to go out naturally, sir?
No. We will discuss this clinical trials later. So we will discuss only this vaccine, right? So again, they will be normal only. So as like other people, phase 1 people will also be normal. No worries. Okay. Okay, we'll discuss this topic elaborately during the clinical trials, right? During the revision lectures also we will discuss it. Okay, no problem. So we discussed these 3 vaccines, OPV, DPT and pentavalent vaccine with the different subheadings: type of vaccine, dosage, route, schedule, constituents, diluents, VVM, vaccine open vial policy, advantages, reactions, and different contraindications we have discussed, right? Okay, so we'll go with the post-test. So you might have learned something in this lecture. So we'll go with the small, quick post-test. So first one, at the PHC level, vaccines are stored in
Iceland refrigerator.
C.
Very good. C is the correct answer. That is Iceland refrigerator. So OPV bivalent vaccine contains which strains?
P1 and P3.
Yes, P1 and P3. P2 we have removed from the trivalent, right? P1 and P3 is the correct answer. What is the adjuvant used in DPT?
Aluminium.
Yes, aluminium. D is the correct answer. Adjuvant. So which of the following is not true about OPV?
Maternal antibody is completely protected.
Yes, you have to remove the odd one out, right? The remaining were correct.
Maternal antibody.
Maternal antibody is completely protected. It is not a correct one, right? Okay. What is pentavalent? 5-in-1 or pentavalent vaccine is?
All of the above. DPT, hepatitis B, and all of the above.
Yes, this is a 5-in-1 vaccine also. And again, you are giving a route is intramuscular. It is containing all the 5. That is DPT, hepatitis B, and Haemophilus influenzae B. All of the above is the correct answer. So, administration of which vaccine will result in paralysis in children as a side effect?
Oral polio vaccine.
Yes, don't miss this question. This is oral polio because we are giving live vaccine. The strains may cause paralysis. That is VAPP, vaccine-associated paralytic polio, most commonly with the type 3 strain. B is the correct answer. Open vial policy is not applicable to which vaccine?
Measles.
Yes, measles is the correct answer. The remaining 3 will come under the open vial. Can you name other than measles which not come under
BCG, Japanese encephalitis.
Very good. BCG, measles, and Japanese encephalitis. You can also add rotavirus. Okay, identify the famous scientist which you have seen in the video also.
Albert Sabin.
Yes. His contribution is very important. That is OPV to the world. B. Then, in one single visit, a 9-month-old unimmunized child can be given which of the following vaccination?
BCG, DPT1, OPV1,
Yes. Yes. We have discussed DPT, which we can give up to 1 year.
1 year.
1 year. Measles 9 months, it is given directly. So again, BCG also we can give up to 1 year. So here it will also come under the 9-month age, old who are unimmunized. D is the correct option. So which of the following value is not efficient for vaccination?
Both B and
B and C.
B and C.
B and C. B and C, sir.
Excellent. So there is a multiple option. You have to see. So it matches and it is crossed. So B and C are the correct options for this question, right? Okay, thank you for your patient listening. Again, the right vaccine at the right time. Blessings for a healthy life. Okay, stay safe and have a nice day.
Thank you, sir.
Thank you, sir.